In the immediate postpartum period, the first 2 hours are the most critical. This is where mom is most likely to have a postpartum hemorrhage. You'll get vital signs every 15 minutes for 1 hour and then every hour for 4 times. It is common to give Pitocin 20 units IM or IV immediately after delivery. We want to prevent postpartum hemorrhaging. Postpartum hemorrhage is the most common complication, and we want to prevent that. We want the mom's goals to be stable, normal vital signs. She will have her perineum inspected and repaired, and we want that to be intact during the immediate postpartum care period. We want to assess for any obvious complications, lacerations, trickling of blood out of the vagina, hematomas, or increased swelling. We want to make sure mom can void. We want her to initiate skin-to-skin contact with the baby. It helps promote bonding, and it helps regulate baby's temperature. We want the mom to initiate breastfeeding within the hour. Breastfeeding helps to stimulate that natural oxytocin that will help contract the uterus and help clamp it down to prevent bleeding. We'll do the fundus check. Immediately after the baby is born, fundal massage begins after the placenta is delivered. When you do the fundus check during this time period, it should be at the umbilicus or plus or minus 1 centimeter around that. We want to massage it until firm. We'll also do the fundus checks every time you take vital signs. Watch for excessive lochia and bleeding. It is important that the mom has some PO fluids or IV fluid replacements after delivery. It's a good idea that she can eat if she's not nauseous and vomiting, and then to get some rest. Monitor for suprapubic distension, and that is when the bladder is full. We want mom to void at least within 6 hours after delivery. Remember, a full bladder can increase bleeding because the uterus cannot contract fully. If she experiences postpartum shaking, that's normal, and we'll just give blankets for comfort. For pain control, we usually will give just ibuprofen or other NSAIDs to help control pain. Narcotics are not commonly given postpartum anymore. If she had an epidural, the epidural catheter will be removed and a sterile dressing applied to the post-op site. We will watch for return of sensation in her legs to fully come back. We don't want her to get up without help. Orthostatic hypotension is common after delivery, and we don't want her to be dizzy, and sometimes fainting is very common, so we will assist with getting up. We'll use the BUBBLE LE acronym to help us learn about postpartum care. The first B is for breast. The breast produces a substance called colostrum for the first 3 days of life for the baby. Then the breast will begin to produce foremilk and hind milk, which comes in days 3 to 5. That is sometimes when you hear women say their milk has come in now. During this time, they may have a period of engorgement. Signs of engorgement include fullness around the postpartum days 3 and 4, so they have fullness in their breast and they become really enlarged and tender and hard. We will express the milk in the shower, and that will help. We need to watch for signs of mastitis. Mastitis is an infection in the breast, which is very common postpartum during breastfeeding or when the milk is going to be compressed to go away. You can still develop mastitis. It has flu-like symptoms, and the breast will be hot, red, and painful, maybe some edematous areas, and they may have pain and fever. They feel kind of ill. It does feel like they have the flu. So the treatment for this is to keep nursing, keep breastfeeding, and does not hurt the baby, and we will give antibiotics to treat the infection in the breast. If mom develops cracked, blistered, or sore nipples, we need to ensure that she has a proper latch while breastfeeding. A poor latch is usually the main culprit for sore nipples or cracked nipples. So what the mom can do to help alleviate this issue is to make sure she has a good and proper latch. She can also express the breast milk or colostrum and put that on her breast and let it air dry. She should not use any soap on her breast or nipples. She should use just water, and that will help keep the dryness from happening to the nipples. They do make creams that the woman can use, like a lanolin cream, which is kind of a protective barrier for the nipple. Moms who are breastfeeding should wear good supportive bras that help support the breast as they begin to produce milk. One treatment option for engorged breasts to help with the sensitivity and the pain is to put wash-dried cold cabbage leaves on the engorged breast, and they can put them inside their bra or cover them with a cool towel also. It helps alleviate some of that pain, and those should leave the cabbage leaves in until they become wilted, or about 20 or 30 minutes. One of the most important postpartum assessments is of the uterus. The process of the uterus returning to normal is called involution. We measure the fundus by placing one hand on the pubis and another hand on top of the fundus. You'll find the fundus by checking at the umbilicus and pressing inward, while supporting the other side of the uterus at the pubis bone. The top of the fundus should be firm. The top of the fundus should decrease by 1 centimeter every postpartum day. At delivery day, you should be able to find the fundus around the umbilicus, and then it should decrease by 1 centimeter every postpartum day thereafter. The nurse should teach the mom how to find and massage her own fundus. It is important that she knows that she should make sure that her fundus is firm as often as possible. With it being firm helps control bleeding. If your fundus check reveals a deviation to the left or to the right, that would indicate that the woman has a full bladder. Remember, she should keep her bladder empty in order to allow her uterus to contract fully, to compress the blood vessels inside the uterus in order to decrease the amount of bleeding she will experience. After about 14 days, the uterus should be non-palpable. Upon assessment of the fundus, you want to determine if it's midline in the pelvis or displaced to the side or laterally, which is caused by the full bladder. Determine whether the fundus is firm or boggy. If the fundus is boggy, which is not firm, lightly massage the fundus in a circular motion until it does become firm. Encourage breastfeeding for a client that is lactating, which will stimulate the production of natural oxytocin and prevents hemorrhage. Encourage the woman to empty the bladder every 2 to 3 hours. Reinforce to the client that this will prevent possible uterine displacement and a loss of muscle tone. Next is B for bowels. Check for reports of hunger. Expect the client to have a good appetite after delivery. Check for bowel sounds and the return of expected bowel function. Spontaneous bowel movement might not occur for 2 to 3 days after delivery, secondary to decreased intestinal muscle tone during labor, and then also they may have had pre-labor diarrhea and dehydration. The client can anticipate discomfort with defecation because of perineal tenderness, episiotomies, lacerations, or hemorrhoids. Check the rectal area for hemorrhoids if there are some complaints. Encourage the client to take measures to soften stools and promote bowel function. Those are early ambulation, increased PO fluids, and high fiber foods. We will give stool softeners to prevent constipation. If they have had a C-section delivery, we must check for bowel sounds, and they must have had past gas before they are allowed to eat.